Hi there, my name is Karen Kerr. I am a student with the Indiana State University School of Nursing, and this is for my class, Professor Dr. Daniel Lucky, Nursing 444. And my population at risk is adolescents aged 10 to 19 who have previously been diagnosed with a mental health disorder. And today we're going to talk about dental health, what you should know, and what you can do. So my objectives: at the conclusion of this lesson, the learner will identify with 80% accuracy what percentage of US adolescents has untreated tooth decay. And at the conclusion of this lesson, the learner will identify with 80% accuracy 2 problems that dental decay can lead to for adolescents. At the conclusion of this lesson, the learner will identify with 80% accuracy 2 things that an adolescent can do to prevent tooth decay. And then at the conclusion of the lesson, the learner will be provided with a brochure with useful information. So I would ask at this point that you stop your video. And here I have a pretest. If you can go through the questions on the pretest, and I'm going to tab through them pretty quickly, so you'll need a little more time. If you can pause the video as you're looking at the questions and just go ahead and answer those. And then I would just let you know ahead of time, we also have a document that you can download that goes along with this presentation so that you can look at the pre-test and post-test questions. There's also a brochure that can be printed and viewed online. So we'll go ahead now and get started. So what you should know. So your dental health, your oral hygiene is a really important part of your overall health. And you should know that 1 in 7 adolescents has untreated tooth decay. And that includes your permanent teeth. So as a adolescent, this is the time when you are growing your permanent teeth. And you know, most of you have probably lost or working on losing your baby teeth now. And so your permanent teeth, they stay with you for the rest of your life. So it's really important to take care of your teeth. It does affect your overall health. And it's important to take care of them because these are the teeth that you're going to have for the rest of your life. So keep that in mind. Also know that tooth decay is one of the most common chronic diseases for children. So tooth decay, when we're thinking about adolescence, it can cause pain and or infection, and it can lead to different health problems. And some of those that are really important to the adolescent, it can affect your eating. If you have mouth pain, it can be difficult to eat. It can affect your learning. And research shows that students actually lose time from school, so they're not able to go to school. Additionally, it affects their, like their attention and their ability to learn. So it affects the learning in different ways. It can affect your talking, and it can even affect just your playtime. So you should also know that there is a positive relationship in adolescence between oral health and mental health. So there are correlations between the two. And the odds of a child having good oral health are decreased if that child has a mental health problem. So this is something important to remember, that this is something that you want to be careful to think about and develop really good habits, because this is an area where you may have struggles. And we know that it's important to have good oral health. So putting together, we're going to talk about some things that you can do. And so putting those things together to create a really good lifestyle habit is going to be really important for you. Other things to know that this might affect some of us, that if you come from a lower income family, as we compare to a high income family, you're twice as likely to have cavities. And so that's just another factor that we want to keep in mind, that reminds us that it's important to take care of our oral health. So things that you can do. A really important thing that you can do is to limit your sugary foods, especially if it's in between meals, like snacking. So things like sugary cereals, if you have cereal for breakfast or snack throughout the day, if it's got added sugar in it, it's something that's something that you want to avoid. And another thing is fruit juice. So avoiding fruit juice has a lot of sugar in it. So avoiding that, and also sugary soda, avoiding the sugar in soda is going to be beneficial to your teeth. And then avoiding candy. And, you know, we all like candy, but it's a good thing to avoid, especially in between your meals. So things that you can do: think about brushing your teeth 2 times a day for 2 minutes at a time. Use a soft toothbrush. And you also want to remember to use a toothbrush that is in good condition. So probably every 4 months, you want to be replacing that. And you want to use a toothpaste that has fluoride. So when you're at the store, you can look at the package and see, does it have fluoride listed on it? And also, is it approved by the American Dental Association? Because those are the toothpaste products that are going to be better for your teeth, for strengthening your teeth. So other things you can do: you can visit your dentist, and it's suggested that you visit your dentist every 6 months. And that's especially important. I'm talking about this group because we've identified that you're at high risk. So it's really important to go see your dentist. And keep in mind, if you're under 15, your guardian may need to be there to make decisions about your health or financial things like that. But make a plan to see your dentist. So other things you can do, I've got some resources for you. In Multnomah County, where we are, there are 7 clinics that provide dental care through the Multnomah County Health System. So I've got a link here that you can utilize. If you have OHP, which is the Medicaid or Care Oregon Dental, you can go to those clinics. If you're not insured, you can still go there. There are fees. They're based on family size and income. And if you don't have insurance, I've got a number here that you can call to see if you're eligible, if you can get insurance set up. There's people there who can help you. And this may be something that your parent or guardian would be doing, but you can point them in the direction. And then I've also got a link to the Oregon Dental Association, and that's another link to finding a dentist. So check out that one. Of course, if you also have other, like a different type of health plan, your health plan is going to have specific places where you can go as well. So take a look at those links. Here's a list of my references. So take a look at those so you can see where I got the information that we talked about today. And there's also a few links in there that you could utilize. So this is my post test, and if you can go ahead now and go through the post test,